Okay, we're back. We apologize. We had a little bit of a filler piece there, waiting on our guest to get here. I had to say that.
That's good.
Okay,
That's good.
Okay. All right. So it is now time for Ask the Doc with Dr. William Whaley, and he's not able to be with us today. And it's brought to you by Georgia Cancer Research Center, affiliated with Northside Hospital. So Dr. Whaley's not able to be with us, but I will tell you this before I introduce you. This is the way I'm going to do it, is every week when we have Dr. Whaley on the show and we ask the questions, when he gets done answering them in full detail, okay, we'll say that, okay?
Yep, good detail.
Good detail, right? But when Dr. Whaley finishes answering the questions in full detail, he said, now, if that's not working, it's time to make an appointment with Ray Tidman.
Oh.
That's right. He always says, that's when I got to send you up the hill to see Ray Tidman. Dr. Tidman, how are you today?
He's very kind. I'm doing good.
So we felt if he was out of town, we should do what he always recommends, bring in Dr. Tidman.
All right, I'm here.
How are things going?
Doing okay.
Good?
Doing all right.
All right. Now, you do know you owe us a joke, so did you bring one?
I've got a good one.
Okay, you have a good one, so we'll go with that. We're going to go with our question. Let's start with our first question. My doctor recently recommended me getting more Omega-3 fatty acids in my diet. Which fresh produce and good sources of Omega-3 fatty acids are there out there?
Well, you can move to Alaska and be an Eskimo and eat fresh fish, or Japan and get a lot of fresh fish. That's where most of it comes from or came from, and that's where the theory that maybe it was good for the heart. Most of the studies, or even recent studies lately, showing supplements of that do not increase longevity. So you're seeing a lot of physicians pull away from recommending. Nothing wrong with it, and there's no reason why you couldn't take it, but the science on it is not bearing out.
Well, even though, although the science is not bearing out, if a person wants to their diet with Omega-3 fatty acids, what are some of the good sources?
So, I mean, I'm serious. Fresh fish.
Just fresh?
Yeah, unprocessed fresh fish.
And
that's going to be your best source.
Your best source?
Yeah.
Okay. Now, the question is, I am a 57-year-old female. Okay. You ready?
I'm ready.
Okay. I am a 57-year-old female, and I have started having issues with bladder control. The only issues I have is when I go to the restroom, and when I get there, I don't quite make it. Is it normal for my age, or should I get checked? I have not had any other issues, and I have never had children or any other health problems.
Okay, so we would call that urinary urgency and a slight loss of control. The straight answer to the question, it is not normal, but it is common. And it needs a diagnostic workup. That would be done by a urologist or gynecologist that also specializes in urinary issues. And there are many kinds of treatments, from medicines you can take to procedures where they actually put a filler in that helps you tighten up that sphincter, that muscle that controls your bladder. So it's not something to live with, but it doesn't necessarily mean it's a bad disease state going on or anything terrible that's happening to you, but it is definitely treatable.
All right, well, what Dr. Whaley will say all too many times is in the question, it was important to know the age, giving the age. So are these things that are...
What's interesting in the question that she points out her age and her parity, that is how many children she bore. As we get older, that's more common. And if we've had a lot of children in our younger years, it's more common. So she doesn't have two of the significant risk factors, which would mean all the more reason why to go get this addressed sooner, because she's got a lot of years ahead of her, and it'd be nice to get this under control.
Okay. Anything going on out there in the world of medicine or research or anything like that you'd like to share with the audience that's happening now, or something that that's just going on out there?
Well, one of the incredible things about America is the amount of medical innovations and research that we do. I think I'm not exactly sure of the numbers, but childhood cancer has been cut in half in the last 25 years. Survivability, and it's just an awesome number. Our longevity goes up. Now, one of the things that's a real negative is for men in the first time, their longevity did not go up last year, actually dropped a little bit. And there's
elaborate a little bit on men's health, because you always do. I didn't mean to interrupt you, but we always, when you come in, we get more of an opportunity to talk about men's health.
Well, it's particularly worrisome. I mean, the suicide rate in young men has gone up, depression's gone up, certainly drug use and deaths from drug use has gone up. So it's not an occupational thing, it's not a work hazard type thing, but I think it's a social or society thing where men are really getting the raw end of the stick, in my opinion. Hopefully as a society we can turn that around, but we've become a very caustic society in some ways and very at each other, which should not be happening. I blame it mostly on the mass media, which seems to be wanting to constantly rile things up or have people get at each other. But it is a real worry about what's happening with young men in particular.
So in men's health, we always talk about the men that won't go see the doctor.
Right.
And you always encourage them to make that visit.
Yeah, the things which bears repeating. Young ladies engage healthcare early.
Right.
They have cycles that they go through that they seek care for. They have babies when they're young, and so they engage the healthcare profession early and know how to interact with it and do it. For us guys, we get a sports physical in high school, and unless we break something or rip something open, we don't ever see the doctor, and we get up into our 50s and 60s, and the warranties go out, and parts start breaking, and we figure they're going to fix themselves, but they don't. So I encourage guys when they've got something new going on that's really bugging them, you're not a hypochondriac to ask that question or seek help, and it could be just a phone call. I advise all people, men or women, when they're seeking their first health care, to ask friends, people they trust, who they see, who do they use. That's the best way to vet medical care, is if you've got somebody that you trust and they see somebody and they recommend them, then that's better than any advertising that you can get, and it's certainly superior to what the insurance companies offer you.
How common is it with men, and continue this discussion just a little more, how common is it in your practice to sit down with what age group do you see and hear men say, well, I haven't been to the doctor in 30 years? When do you start seeing some men?
Oh gosh, I see that in men in their late 40s, early 50s who just never see the doctor, never. By the mid-60s, by Medicare age, things are going on with most people.
Right.
And most men have at least one issue they're dealing with, so they're starting to engage and get comfortable with either getting their blood pressure treated or their cough or something that's going on that they need help with. So it's that 50 to 60 age range when there are some screening things that should start happening.
What are some of those screening things?
PSAs, an annual PSA, particularly in high-risk families. A single number is not useful. You need an annual number.
Tell people what we're looking for.
So PSA is the prostate-specific antigen.
Right.
It looks for prostate cancer in men. And the example I use is that you could have a normal, in most labs, normal PSA is under 4. Okay, so you could be coming in to see me. You're 58 or so. You're starting having some urinary issues. We do a PSA and it's 3.8. Okay, it's under 4, it's normal. Next year you come in, because we asked you to come in next year, and it's 4.8. Okay, that's a 25% increase in that number. Now 4.8 is not a big number. It's not up in the 8, 9, 10 range that you'd see in an older person with prostate cancer, but that's a big jump. So I'm going to pay a lot of attention to that, and probably get urological intervention sooner, or get an ultrasound or maybe even a biopsy done. So it's things like that where it's important to know trends than it is to have any one test.
What other screening for men at?
Well, when you hit 60, you need colonoscopy every 10 years. Sooner if you've got colon cancer in the family. If you're just absolutely terrified of a colonoscopy, which is really not bad, they just they make you go to sleep or goofy and you don't really care. It's the prep for the colonoscopy that's the hard part. But let's say you just don't want to do it. There's a new test on the market called a Cologuard, where a kit is sent out to your home, and you send in the specimen, and they actually run DNA test on the stool specimen and look for cancer DNA. And you know, it's a pretty good test, pretty amazing that you can do that. So technology is ever evolving. One of the newest things that's happening in medicine, you asked earlier about innovations, there's a PCR test now where we look for the genes of certain bacteria and viruses in human secretions. So if I've got a patient that's just got this persistent cough or productive sputum producing thing and they're not responding, we can send that sputum off and within a few days have a report come back to us that tells us what organism is in there. I mean, specifically, maybe even 2 or 3 organisms, some of which may not be treatable, but some which may be very treatable and very different. So those are really cool, exciting innovations that are occurring.
I appreciate it, Dr. Tidman. Dr. Ray Tidman here with us this morning. And anytime Dr. Tidman is with us, we take the opportunity to talk about men's health. It's one of the times that we get to focus on that, and we always appreciate talking about that. Now, before you go, do you have a joke? Do you have a joke
now
for us?
You know the answer to that.
All right, we want to know if you have a good joke for us today.
Yeah, I've got a great one. I want to give kind of a shout out to 2 people we lost this last Christmas, and my nurse Renee and my research gal Michelle.
Yes.
And Brittany, who was fighting to get her mobility back down in Atlanta, and Robert up in Blairsville. So that's been a big tragedy. But for I guess well over a month, I was pretty glum. But then I realized, you know, Renee would be pretty pissed off at me if I didn't tell my patients jokes. So
right.
I'm back at it.
Okay,
so.
Good. We're glad you're back at telling jokes, and we do understand here on the show and understand what you're saying, and the tragedy and all that you've gone through up there and the families. Okay,
so 2 farmers, they're at a convention. They're at a farming convention. A farmer from Georgia and a farmer from Texas. And the farmer from Georgia goes, you know, you boys in Texas, you got big farms. How big's your farm? The Texan says, well, my farm's so big, I'll get up in the morning, get in my truck, drive all day, drive all night, and not get to the other side. The guy from Georgia said, you know, I had a truck like that one time. It was the fuel pump.
I have to bring it back. So it's a fuel pump. Okay, drove all day, couldn't get to the other side. Well, listen, we thank you, and we're glad to know that you're back to telling your patients jokes up there, and we understand. We appreciate you, Dr. Tidman, very much. I always enjoy you coming in. All right, we want to thank Georgia Cancer Research Center, affiliated with Northside Hospital, for this segment, and you can always find these segments on the FYN TV Fetch Your News YouTube channel, and you go there and find on the playlist Ask the Doc, and you can find all these segments to send to your family and friends if you want to share them with them. But if you have a question for the doctor, you send us an email at info at fetchyournews.com and put in the subject line, Ask the Doc. Again, Dr. Tidman, thank you very much. We appreciate it. We're going to take a brief break, and it'll be time for the All-Star Political Panel. It's a guy's kind of day, maybe, huh? Wow. All right, All-Star Political Panel right after this.